So, 40 weeks after conception, the baby will most likely be born. And when a baby's ready to be born, the mother will go through various stages of labor. The first stage of labor, stage 1, is 12 to 24 hours before birth, approximately. And it's during this period where the mother will start noticing that her contractions are becoming increasingly stronger and more rhythmic. The cervix, the opening for the baby to come out, enlarges to approximately 10 centimeters. Stage 2, which is less than an hour before birth, this is when you need to pack up your stuff and go to the hospital. Stage 2 is when the baby starts to pass through the cervix. Actually, you probably should have gone to the hospital already, but if you haven't, you definitely need to go now. The baby is literally starting to come out. And the baby's head will start to become visible. This is something we call crowning. Stage 3 is basically the stuff that happens shortly after the child is born. So just to try to illustrate what this might look like without getting graphic, I'd like to use this. So this is our little stand-in baby, and this will be the cervix. So at stage 1, the baby is head first. That's important. The baby's head first with its head right against the cervix, and that means it's in a good position to be born. And then as stage 1 progresses to stage 2, the cervix will enlarge and the baby's head will start to become visible, like you should be able to see the top of the head. And then stage 3, the baby is out, and now just the placenta and the rest of the bits come out. So that's how labor works in these 3 separate stages. Now, when it comes to how we deal with childbirth, there's been different approaches. In the past, childbirth was considered a form of like a surgical procedure. We used various tools and drugs to try to help the child be born in as painless and most efficient way possible. Like medical professionals would use forceps of various kinds to literally like clamp the baby's head and pull it out. These forceps didn't look too dissimilar from what I'm holding right here. Just imagine this like clamping onto a baby's head and they just pull it out like that. That seems scary. It seems really old school and retro and pretty messed up nowadays, but they still do use forceps, but in rare cases, only when it's absolutely necessary because of the obvious danger to this little baby's squishy head. Nowadays, it's a lot more popular to use what we call a natural approach to childbirth. This just means that we use very few tools, very few medications and techniques. Instead of using medicine to help these mothers have a good childbirth experience, we use psychology. So expectant mothers are taught various exercises like breathing exercises and muscle exercises and other kinds of techniques to just help them prepare for what's going to happen so that they can more efficiently give birth. But just to go a little bit into the future, after the child is born, the parents are going to have to go through a big adjustment, especially if this is a first child. Most people, even if they think they're prepared, even if they've practiced, even if they studied, nobody's ever really ready to have a child. Becoming a parent is a huge adjustment. Like, these new parents aren't going to get to do nice things anymore, to put it simply. Like sleep, for example. Sleep is a luxury at this point. And as a result of all this new stress and responsibility, a lot of these new mothers will experience irritation, resentment. There's going to be a lot more emotions and crying, and just the effects of stress will be pretty profound in approximately 50% of these new mothers. And that's normal. What's not very common, though, is called postpartum depression. This does happen, unfortunately, to a pretty large percentage, but it's not as common as just this short-term like adjustment period. Postpartum depression affects about 10 to 15% of new mothers, and it results in like extremely low levels of self-worth, irritability, disturbed sleep, poor appetite, and apathy. And I've heard of some pretty classic examples of this. Like, I know somebody, a friend of mine, after they had their first child, his wife just couldn't handle it. And she literally like shut down for a whole year. Like she just couldn't deal with the baby. She was not even comfortable being around the baby. Like she just wasn't able to handle this. And when you see cases like this, it's easy just to point at the mother and say, "Oh, you're a bad mother because you're not doing X, Y, and Z." But the real cause, the real risk factors here are generally the mother's support group. So if a new mother feels like she has good social support, if she feels like there's people in her family and in her friends that will be there to help her with this new responsibility, then typically you're not going to see this kind of reaction. Postpartum depression only really occurs when women feel alone and unprepared. There is one other thing about this that's kind of interesting, and that's breastfeeding can help to combat this problem. So if a woman is feeling these kinds of things, breastfeeding for hormonal reasons can fight against it, can help her to overcome it. Besides these kinds of things that can happen to the mother, there are a lot of things related to childbirth that can affect the developing baby. There's a lot of birth complications, for example, that could occur during labor and delivery. Many of these complications can result in what we call hypoxia. That just basically means the child is suffocating. The umbilical cord is not providing enough oxygen for this child that's coming out of the birth canal. And if this is a concern, this can result from a baby not being born in the correct position. Like I mentioned before, baby should be head first. So if the baby's like in some weird position, or if the umbilical cord gets wrapped around, if these are concerns, which you can identify by doing an ultrasound or other kind of imaging, then your doctor might decide to go with a cesarean section, C-section, which refers to the surgical removal of an infant from the uterus through an incision made in the abdomen. I jokingly like to compare this to the Alien movies. If you've ever seen the Alien movies where the alien, bursts out, it's basically like that, but it's a lot, happier because it's a little baby. It's not some scary alien, but it's conceptually similar. Now, there are a lot of possible complications that could result in wanting to go with a C-section. Here's just a short list. Like there's cephalopelvic distortion, where the infant's head is just simply larger than the pelvis, making it impossible for the baby to pass through the birth canal. This can be especially problematic for smaller women. This is something I have personal, I know somebody who had this happen to them, and they had to actually surgically enlarge the cervix with scissors. Sounds scary and gross, and it kind of is, but you got to do what you got to do, I guess. A regular position, I already kind of described that, when the baby's not being born head first. Like some babies are born in a position we call breech. It just basically means they're being born butt first, and that can be a real problem. Preeclampsia, when a woman has very high blood pressure and protein in her urine and swelling in her extremities. And prolapsed umbilical cord, which is something I was already kind of describing. That's just basically when the umbilical cord is, crimped. It's squeezed shut for one reason or another, and this results in the baby suffocating to an extent. So there's a lot of things that could go wrong, but that the doctors who specialize in childbirth and delivery and whatnot, they know what they're doing, and they can screen for these kinds of things before the child is born and make sure that there's nothing to worry about. So if you are interested in a natural birth, that's great, but I strongly recommend that you still consult medical doctors before and during childbirth just to make sure that you don't have to worry about any of these kinds of complications. Now, some babies are born too early. These premature births, these preterm births, what we generally consider to be preterm is anything before the 36th week of pregnancy. And obviously, if a baby's born too soon, too young, then it's going to have a lower birth weight. And depending on the birth weight, there may be cause for concern. So babies that are less than 5.5 pounds, we consider that a pretty low birth weight, but it's not a serious cause for concern at this point. However, if the child is less than 3.3 pounds, we would call that a very low birth weight, and that's where the child is going to have a lower survival rate. There's a less likelihood that child is going to be able to make it. And if the child is born below 2.2 pounds, that's an extremely low birth weight with an extremely high risk of fatality. That extreme measures need to be taken immediately to try to preserve the life of this newborn. And while these preterm babies, if they do recover, if they do, survive this premature birth, while they do tend to have difficulties at the beginning of their life, as they grow older, they will eventually grow out of it and they'll be just like anybody else. So they'll develop pretty normally after the first couple of years, but those first couple of years can be pretty problematic. It can be scary from time to time. Now, I mentioned that if infants are born too early, they may not make it, and that's an unfortunate truth. Not every infant who is born is going to make it. That seems obvious. But infant mortality is something that we use as like an index. You can think of infant mortality rates as like an index for how good and how available medicine is in your country. It refers to the number of infants out of 1,000 that will live past their first birthday. Now, in the United States, only about 0.7%, or 7 out of 1,000 infants, will not make it to their first birthday. So 7 out of 1,000 seems like a great number. It seems like we're doing a really good job, and we are. But when we compare the United States to other countries that are similar to us culturally and financially, and countries that are very dissimilar, what we generally see is that we could do a lot better. Japan has an extremely low infant mortality rate. And next in line would be Sweden, and then Italy, France, Spain, Germany, Netherlands, Ireland, Israel, Australia, United Kingdom, New Zealand, and Canada. They all have lower infant mortality rates than we do. And we're supposed to be one of the richest countries in the world. So it just kind of makes you wonder what we're doing wrong here. It's obviously not due to a lack of money. It's due to something else.